Hi everyone, my name's Brian and I am a mental health nurse and a student in the Psych Nurse Practitioner program. Today I'll be giving a little patient education on post-traumatic stress disorder. We'll be going over what this condition is, some of its symptoms, and treatment options. So let's get started. So what is PTSD? This is a mental health condition that can develop after experiencing or witnessing a traumatic event. And this can include events such as a serious car accident, a natural disaster, being in combat, or just dealing with some other type of assault. It's normal to be afraid, anxious, or upset after an event like that, but PTSD occurs when these symptoms don't go away and last for longer than a month and really begin to interfere with the person's life. In the US, it's estimated that about 3.5% of adults are diagnosed with this condition each year, and the lifetime prevalence in the general US population is about 6.8%. There's many cultural attitudes that affect how this condition is diagnosed as well. Some cultures don't really agree with a person displaying their emotions, especially emotions such as this that are troubling, because it's often seen as a sign of weakness. So in many cultures, symptoms such as from conditions such as these are underreported, and treatment is even delayed or not sought at all, which can often exacerbate the symptoms and make this condition worse. It's important for healthcare providers to be culturally sensitive when dealing and diagnosing with patients who might have this condition. This just includes understanding where the patient is, their cultural background, their beliefs surrounding mental health, and potential barriers they might have to seeking care. Understanding these sorts of things, we can better understand how we can meet the patient where they're at and help them get the care that they need. So now let's go over some of the symptoms of PTSD. They're kind of grouped into categories. So the first one we'll go over is the re-experiencing ones. And this includes symptoms such as flashbacks, or the patient just remembering the events, the traumatic situation that originally started all their symptoms. They might also have nightmares or other intrusive thoughts that just sort of disrupt their daily life. Other categories include avoidance, and this category just basically includes the symptoms of the patient avoiding certain places, people, or even situations that remind them of their trauma and cause them to experience distress. The next category is hyperarousal. This is when the patient starts feeling jumpy, they have difficulty sleeping or just relaxing, and can be easily startled. This goes to the patient's fight or flight response being activated and them just being unable to shut it off. Lastly, we have negative thoughts and emotions surrounding this condition, which includes feelings such as shame or guilt and depression or detachment from others. So fortunately, this condition is treatable. There are many medications we can offer the patient to assist with their symptoms, as well as therapy. Some of the medications include antidepressants like SSRIs or SNRIs, and even mood stabilizers like Zyprexa. These medications just basically help to balance the chemicals in the brain that are responsible for affecting mood and anxiety, and help to reduce the symptoms of depression and anxiety associated with it. The patient might also be prescribed something for anxiety. This is typically short-term and might include something like a benzo like Ativan or Klonopin to help get them through those really hard times. Some therapeutic options we might include cognitive behavioral therapy. This is a type of therapy that just helps the patient to reframe the negative thoughts that they're having surrounding the trauma and to learn healthier ways to cope with their symptoms when they do arise. They might also be prescribed cognitive processing therapy. This is another therapy that helps the patient just focus on changing the negative beliefs they hold around their trauma. We have prolonged exposure therapy as well, and this basically just involves the patient safely confronting their trauma-related memories with a healthcare professional who is qualified in helping them safely achieve this. And lastly, some other options we might have include mindfulness and meditation. And these practices basically just help the patient to stay grounded in the present moment, to reduce the stress, and help them manage the triggers and intrusive thoughts when they do arise. And there are many resources out there to help with this condition. One of the most informative resources out there is the National Institute of Mental Health, or NIMH.org. And this is just a professional research organization that offers detailed information on this condition, as well as many others, how it's treated, and ongoing research for it. We also have the American Psychological Association, or APA.org, and they put out a very nice medication guide for PTSD, and it just provides material about the medications that you might be prescribed while treating this condition. Lastly, there's plenty of local and online support groups as well, through social media, or you might have some local efforts going on to help with this condition and help connect patients with others. Well, if you're still with me, I appreciate you for getting through the video with me, and I hope you were able to learn something valuable today about this complex condition. There are many options we have in managing it, and people don't need to suffer. There's things we can do. We just need to increase awareness about conditions such as these, and that the fact that they can be treated. Again, my name is Brian. I hope that everybody has a great rest of their day. Thank you.